Mr. Crawford? Hi, it's nice to meet you. I'm Dr. Thompson, and I understand that you are here today. You were referred by Dr. Little from the emergency department. I'm just going to tell you a few things that I have in my file and let you know that you are here today for a cranial nerve examination. And it's just a simple set of tests to check to make sure that everything's working properly. There won't be anything invasive. We're not going to do any scans or anything of that nature. I'm simply going to test your vision, your sense of smell, and just make sure everything's working properly. Have you ever had a cranial nerve examination before? No. All right, well, most people haven't. And typically you would only have this done if you had suffered some sort of head trauma. And it's just a test to make sure that everything's working the way it should. I want to go over some things before we get started. Okay, I have some notes here that were sent over by Dr. Little from your test, and I want to make sure that I have everything correct. It appears that you were admitted to the emergency department last night around 11 o'clock. And can you tell me who brought you there? Did you drive yourself or your wife? Okay. Okay. And can you tell me a little bit about what happened? All right. Okay. So you fell down some stairs. Had you consumed any alcohol or used any type of drugs? No. Okay. And it looks like you were discharged around 2 a.m. Can you tell me what happened after that? Can you tell me about what time you went to bed? And how was your sleep? Do you have any trouble sleeping? Any trouble waking up this morning? No? All right. And I know the nurse was in here earlier and she checked some things. She's got your blood pressure and your weight. I would like to check a few things myself, if you don't mind. First, I would like to listen to your heart and I want to listen to your lungs. So I need you to do, I'd like you to sit up straight. I'm going to listen. I'm going to listen to your lungs and your breathing. If you would please take a deep breath in and let it out. And again. And again. And one more. Take a deep breath in and let it out. I'm going to listen to your back. I'm going to reach around behind you. And you can just breathe normally. Just going to place my stethoscope on a couple of different sections of your back. All right. Sounds good. Have you had any illnesses lately? Have you had a cold or anything of that nature? No. All right. What I'd like to do now is listen to your pulse, or take your pulse. If you would just rest your arm on your lap. I'm going to take your pulse. Just gonna hold your wrist right here. you had any discomfort or any other unusual symptoms? Really? That's interesting. I'm going to make a note of that. Can you tell me what you were doing when that occurred? So you felt faint. That is important. Well, that's very likely the case, but we will want to check that out. I'm going to have the nurse come back in when we finish. I'm going to have her check out your blood pressure again. Oh, that's nothing to worry about. It's nothing. We're going to check it out. We're going to make sure you're okay. The first thing I want to check today, I'm going to use this, and I'm going to check your vision, your pupils. It has a little light so that when I press this down, it lights up. What I'd like you to do, just look straight ahead. Okay. Just look straight ahead, don't look around. And the first thing I'm going to do, I'm going to shine this light across. I'm going to go from one eye to the other. Now, I'm going to hold the light for a moment in one eye, and then I'm going to move it away. I'm going to do the other eye. All right. I would like you to look up for me. Just look up toward the ceiling. And just hold it there, please. Try not to blink. I'm going to look directly. Okay. Just look straight up. There you go. That's right. The other. All right. Now, I'm going to hold this pen. I would like for you to look straight at me. Follow the pen with your eyes. Don't move your head. I want you to just focus on the black part of my pen. And I want you to look straight. Only move your eyes. Don't move your head. I'm going to move it in an H pattern like this. And I only want you to follow it with your eyes. Okay, we're going to start. All right. Good. Now, I want you to pay attention to my index finger. I'm going to move it. First, we're going to go horizontally, and then we're going to go vertically. I would like you to keep your eyes and your head facing forward. Please tell me when it begins to appear blurry, or you can no longer focus with your eyes facing straight. Don't move your eyes. Don't move your head. Tell me when it begins to look blurry. I'm going to start in the middle. Okay. And I'm going to move it up, and I want you to just focus on the top part of my finger. Okay. Wonderful. Now, I'm going to check, do you wear glasses or contacts? Great. Do you have your glasses with you? All right, if you would please put them on. Thank you. We have an eye chart here, and I'm going to point to different lines, and I would like you to tell me what these letters are. Can you see it okay? All right. We're going to start at the top. The second line. Third line. We're going to go to 4. Sure about that one? Right. I'm going to try 5. Good. We'll try 6. Right. All right. Oh, that's understandable. That's okay. Not a problem. I'm overdue for an eye exam myself. I'm certainly not going to say anything about that. Now, I'm going to check your reflexes. I know this isn't typically part of it, but I'm a little concerned about your dizziness. I'm going to check a couple things I might not normally. It's nothing to be concerned about. Okay, I'm going to check your knee. If you would just relax your legs, relax your knees. Great. And I'm going to do a test with your chin. I'd like you to close your mouth. I'm going to place my fingers on your chin, and I'm going to tap them with my finger. I would like you to try to keep your mouth closed. Don't clench your jaw. Just relax your jaw. Good. Now, I would like you to open your mouth. Open your mouth and try to hold it open. I'm going to place my hands on the sides of your face, and I'm going to attempt to push up. I would like you to try to keep your mouth open as I do that. I'm not going to push too hard, but I would like you to keep your mouth open, and I'm going to apply some pressure under your chin. Okay. Now, this time, I would like you to, we're going to do a similar thing with your eyes. I would like you to try to keep your eyes open as far as you can. I'm going to use my fingers, and I'm going to attempt to close your eyes. I'm not going to push down. I'm not going to apply a lot of pressure, but I would like you to try to keep them open while I attempt to close your eyes. All right. Now, I need you to smile for me. Smile as big as you can. And I'm going to feel the sides of your face. I'm going to check the symmetry and make sure everything is okay. Good. Now, this is going to sound a little silly, but I need you to relax your face and stick out your tongue. Stick it out as far as you can. Okay, that's good. Now we're going to do some tests to check your ability to sense stimulation on your face. And the first thing we're going to do, I'm going to take a Q-tip, and with your eyes closed, I would like you to tell me when you can feel the Q-tip and where you feel it. Okay, close your eyes. Good. Now I'd like you to tell me where you feel the Q-tip touching your face. Mm-hmm. And again. Excellent. Very good. Wonderful. Mm-hmm. Great. You can open your eyes. The next test looks a little scary, but it's not. I have a small needle. I'm not going to hurt you. I'm going to apply a very slight bit of pressure. I will not poke you. And it will not be centered solely on your face. I may do your neck or the back of your head or your scalp. And I would like you to close your eyes again and tell me where you feel it. All right, now we'll begin. Keep your eyes closed. Just focus on where you feel it. That's right. Mm-hmm. Very good. Oh, that's okay. It's okay. That's not bad. That's a good sign. Okay, you can open your eyes. All that is good. Now, I would like you to relax your shoulders, relax your neck. Now, I would like you to turn your head as far as you can from one side to the other and tell me how far back you can see. Tell me the farthest back when you turn your eyes in that direction as far as possible. Tell me what you can see. Tell me how far back you can see. We're going to start with you going to the right. Turn your head. Okay. Are you experiencing any discomfort, any pain? Turn back forward and turn this way. Wonderful. Is there any discomfort when you do this? No? Good. Now, I would like you to look up. Look up as high as you can and move your eyes back into your head as far as you can. And I would like you to hold this for a moment. I would like to feel right under here while you do this. And when you get up there, it may feel a little uncomfortable, but I would like for you to swallow. Just swallow once you get it up as high as you can. Okay. Now please hold that. I'm just going to feel right up under your neck. And now if you would please swallow for me. Okay. Good. You can bring your head back forward. You're doing great. I have another test for you. This is going to test your sense of smell. I have 3 cups. And inside each cup is a cotton ball. They are soaked in a colorless liquid. I'm going to keep them separate. And I would like to have you smell one at a time and tell me what it smells like. You don't have to close your eyes, it's okay. I'm going to start with this one. And it's just a cotton ball. I'm going to hold this under your nose. And I would like for you to tell me what's that smell? Cinnamon. Very good. That's right. And we're going to do number 2. would like you to tell me what this is. Spearmint. Close enough. It's peppermint, but yeah. Oh, that's understandable. I love spearmint gum. And we have the third one. You ready? Chocolate. That's right. I love that one. Okay. You're doing great. Okay. Now, I'm going to test your hearing. I have a tuning fork. What I need you to do, I would like you to close your eyes. Close your eyes. And tell me when you hear the sound and which side of you it's on. Then we're going to begin. That's right. Very good. Now, this section is not the most pleasant, but it is necessary. You should open wide, stick out your tongue. I'm going to place a tongue depressor on your tongue, and I'm going to move it back. And that's right. Unfortunately, we do have to do that. I'm going to slide it back. I'm going to try to stimulate your gag reflex. So if you would open up, stick your tongue out, go ah, like that. Very good, very good, very good. Okay, would you like a tissue? Here you go. Yeah. Okay. I'm sorry about that. We just have, it's required. Okay. Now, if you would please, do you have the ability to raise one eyebrow at a time? No, that's fine. I would like you to raise your eyebrows. Raise them up. Can you hold them there? I'm going to try to push on them. Great. Now I'd like you to close your eyes. We're going to do the opposite of what we did a moment ago. I would like you to close your eyes, and I'm going to attempt to open them. You just try to keep them closed. I'm not going to apply any pressure. I'm not going to hurt you. Just keep your eyes closed, and I'm going to attempt to open your eyes. Okay, here we go. Very good, very good. You can relax. Great. I'm going to read a list of words to you, and I would like you to repeat them back to me. Just relax. I'm going to read some words, and I would like for you to repeat them to me. Okay. Familiar. Having. Joint. Eyebrows. Impulse. Expression. Applicator. Interference. House. Routine. Patient. Shingle. Dolphin. accelerate, job, bright, turbulence. Very good. Okay. And one more thing, we're almost done. Two things, actually. If you would shrug your shoulders, hold them up as high as you can. Very good. First, I'm going to feel the muscles here, and then I'm going to attempt to push your shoulders down. Hold them up and resist. Great. Now, you can relax your shoulders. If you would, close your mouth, keep your mouth closed, and take your tongue and touch the inside of each cheek. And do that with your mouth closed. Your mouth should remain closed. Touch the inside of each cheek several times. Great, great. Well, I believe that concludes our test. You did very well. And it appears to me that you have been instructed to see your regular physician, who is Dr. Blake. I know her. What I'm going to do, I'm going to send over these test results along with Dr. Little's notes from last night. I'm going to send them to Dr. Blake. I'll send them today and make sure that she has everything. Do you have an appointment already scheduled with her? No? All right. I do recommend that you see her. I'm going to send these over to her so she will have them before your examination, before you see her. I would recommend that you do that within the next day or two. And she will decide what happens next, if you need further testing or not. And I'm going to give you my card. This has my office's number on it. Dr. Blake can call me if necessary. And if she has any questions, please let her know that I'd be happy to help. Okay, here you go. Great. It was so nice to meet you. I'm going to have the nurse come back in and have her recheck your blood pressure. And I hope that you do make that appointment today. I think that'd be very good, just as a follow-up to see what happens next. All right, great. I'll send the nurse right in. Thank you.